Hi, everyone. It's great to have you here. I'm Teresa Yunkin, and I'm passionate about helping healthcare executives stay ahead of the curve when it comes to new technologies by simplifying IT concepts into simple business speak. Whether you're struggling with data initiatives, trying to make informed decisions about new technologies, or just dealing with the constant changes in the market, I got you covered. Well, as an experienced health informaticist, I'm excited to dive into the importance of data interoperability and data analytics for both healthcare providers and healthcare payers. Well, and today we're going to address two reasons why harnessing the power of data interoperability and analytics projects fail. Well, let's start with data interoperability. In healthcare, data interoperability refers to the ability to have different systems and different applications exchange and use data seamlessly. Now, this is crucial for healthcare providers and payers to have access to comprehensive patient information across the various platforms and settings. Well, reason for failure number one, data is not presented and acted upon in workflow. So, why is this important? Well, for healthcare providers, data interoperability enables a holistic view of patient medical history, their diagnoses, medications, and treatment plans. And this comprehensive understanding helps healthcare providers make well informed decisions. It helps them to improve care coordination and to deliver better patient outcomes. Now, you can imagine a scenario where a patient visits an emergency room and the physician has instant access to the patient's complete medical records. And that includes recent labs, medical history, and any number of different clinical pieces of information that they may need. Well, the level of data interoperability allows for faster and more accurate diagnoses and treatments. And that can potentially save lives and it can potentially better the experience for both the provider and the patient. Well, based on my experience designing and deploying healthcare apps where I spend a lot of time talking to providers and patients about workflow, one thing is for sure, whatever you do, it has to be done in the workflow because solutions that are easy to understand, they drive adoption. And when solutions address different clinical workflows for members of that same treatment team, they become scalable. Now, without adoption and scalability, many promising initiatives will fail. How many of us have implemented an EHR and the provider comes back and says, that's not what I need. I have to go to 8 different screens. I've got to have 12 different clicks. We need to be developing and looking at the beginning with the end users. If we want adoption and scalability to bring us efficiencies that drive down costs and improve the healthcare delivery experience for both the provider and the patient. All right. Reason for failure number two, the data collected is incomplete or of poor quality. Now, for healthcare payers, such as insurance companies and government agencies, data analytics allow them to extract meaningful insights and patterns from the vast amounts of healthcare data that's out there, whether it be from other organizations, from vendors, from patients who are generating their own healthcare data. Being able to acquire and being able to use this data plays a crucial role in both healthcare delivery and payer operations. Now, when you have access to interoperable data, payers can conduct more accurate risk assessments, they can identify high risk populations, and they can also proactively develop targeted interventions for their members. For example, let's consider a payer analyzing data from different healthcare providers to identify patients with chronic conditions that are at high risk of complications or readmissions, right? By identifying these individuals early on, payers can often offer personalized care management programs and preventative services, and those do lead to improved healthcare outcomes and reduced healthcare costs. There are a bevy of studies out there proving this point. Well, this has a direct effect on when you can do that. This has a direct effect on your actuarial projections to understand the risk you're taking on with your membership. It allows for better benefit design to meet the needs of your membership, and it improves the recruitment and the selection of network provider partners to improve the quality of services that your members receive. Well, data quality is the bedrock for any program success. Now, that being said, the importance of data quality cannot be overstated when it comes to data interoperability and analytics. right? When you have failures in data-focused initiatives, what happens is when that data is inaccurate or incomplete, that leads to incorrect diagnoses, compromised patient safety, and ineffective treatment plans. Well, when you have a data governance program that is inclusive of both the payer and the provider data stewards, that results in higher quality data. Now, this data serves as the foundation for accurate and reliable insights, making it essential for successful interoperability and effective analytics in healthcare. Well, when data is of high quality, it can be trusted and it can be relied upon by both healthcare providers and payers and even other stakeholders, right? So, by maintaining data quality, healthcare organizations, and that means payers, providers, and vendors can confidently share and to use the data that they're collecting. It can facilitate seamless collaboration and it can improve care coordination for your members and for your patients. So, in conclusion, data interoperability and data analytics, they're both crucial for healthcare providers and for payers to have. Now, to avoid the failures that I've talked about before, many data initiatives that healthcare organizations should have and have some way to address their high quality data to make sure that their data driven decisions to enhance care quality and to reduce their costs and to optimize healthcare delivery as presented in workflow. And that will allow providers to have a complete view of their patients' health information. And that really does lead to better care coordination and improved patient outcomes. By avoiding these two areas and making sure that you're paying attention to these, you can avoid those healthcare failures. Well, if you want to learn how your organization can develop a comprehensive strategy to promote data quality and how to present that data to end users in an effective way that drives adoption and scalability, I invite you to book a call to discuss how we can work together to develop a customized interoperability strategy that's designed specifically for your organization. All organizations are different, depends on where you're located, who your partners are, and what your networks look like. I invite you to come in and have a discussion with me about that. All right, guys, I'll catch you here next week where we're going to still be talking about data interoperability, why it's valuable, how to integrate it into your organizations, and what's going on in the greater data world, right? Web3 and beyond. We'll talk to you then. See you later. Bye.